right, hey guys, so today we're treating Sana. She has a chronic tear in her upper back, and she's been suffering with this for several years. So we're going to be doing our platelet-rich plasma injection, and you're going to hear her story and how it's affected her life. And a lot of people with chronic pain live this way, unfortunately, without a clear diagnosis. So hopefully this helps someone in need, or share this with someone you think may be suffering. So we'll get right into her story.
So my name is Sana Zaid, and I'm here at Dr. Khan's office because I've had a lot of pain in my back, and I didn't know where it was coming from until I actually came to see Dr. Khan, and he did an ultrasound at his office, and we found out what the reason was. It was a muscle tear in my specifically, I don't know what area that
upper back area.
Yeah,
shoulder.
On my right upper back area. And we're here now to get a treatment for it, but I've had this issue for a very, very long time, and I've gone to physio, I've gone to chiro, I've done acupuncture, I've tried almost everything I could find to fix my pain. I've been on Advil because I just
manage the pain, basically, yeah.
The pain's so bad that every week I go for a sports massage because that's the only thing that's been keeping my pain at bay. The second I stop and I do a lot more work around the house, or I'm a makeup artist, so I always use my right hand, it just gets really, really bad. So yeah, I'm excited. Osama actually found Dr. Adil Khan.
Yeah, so my name's Osama Zaid. This is my wife, Sana Zaid. I was just scrolling through Instagram. I saw Dr. Khan's one of his posts about some sort of therapy he was doing with an athlete.
Yeah.
And I was like, you know what, we tried everything. Let me just shoot him a DM, like a Hail Mary, last resort kind of thing, and let's see what happens. And Dr. Khan responded almost like instantly or the next day, and we touched base. And he was very quick with helping us out and getting to the root of the problem. So we're really, really excited because this has been a journey for Sana and I guess both of us.
Yeah, more than 4 or 5 years.
4 or 5 years, yeah.
I've been dealing with this pain, and honestly, at this point, I thought nothing can really fix it. I'm just gonna have to go on pain medication and try to deal with it that way. But I'm excited.
There was no solution until we reached out to Dr. Khan. So we're super, super amped to see what this treatment can do for us.
And he also said that it could probably 100% heal, and which was like amazing to hear, because it's like sometimes you go to physio, you go to chiro, you go to acupuncture, and they were like, yeah, it's pain management, and you'll have to keep doing it. You'll have to keep doing it for a year, maybe 2 years, who knows. And he just came in and he was like,
25% increase, in decrease in your pain would be like a big deal for us.
Yeah, definitely.
But to hear 90%, 100% is just boggles my mind that something like that that is available. And I think there's not enough information out there because we didn't know of it, and we tried a lot of places, and actually I guess a lot of times we were kind of just told, oh, you got to do just the therapy, do the acupuncture. We couldn't find the root of the issue. And
so I had x-rays as well on my back. One time I ended up in the emergency hospital just because the amount of pain I had, I actually fainted from it. And then my mom called 911 and we went to the hospital. They did x-rays, they couldn't find anything. They just sent me home with a muscle relaxant. And so every time, I've had those episodes a couple of times when it gets so bad that I end up in the emergency because I just can't take the pain. And even talking is painful at that point. So this is going to be like a life changer. People who live with pain know how bad it is, and you just can't be your complete 100% self every single day when you're dealing with pain. And I'm super excited to see how this process goes.
Sounds good. Let's do this. Is that a thing, or
that is a thing? Because I'm not just saying. Some people have very cloudy and white plasma. Yeah. That's because they usually had high-fat diets or lots of processed foods. Okay. I've even had people who ate bacon or something before they came in for a blood draw. Oh, sure. And you could actually see white fat in there.
Oh, that's good to know.
Yeah, no, I know.
Don't test mine because it's gonna be the opposite.
And you're going to get this dark spot.
Yeah. So is that dark spot basically the tear?
Yeah. What it is? So basically you can see the black area there, so that's swelling and tearing of the muscle fibers. And then if you go onto the other side, you see the equivalent, you can see the actual gray fibers there. There's no black hole, there's no swelling of the muscle, so you can see there's clearly damage on the right side. So that's what we're going to target with the plasma. So the plasma is going to help to reduce inflammation and heal the tear. This will be a walk in the park. All right, ready? 1, 2, 3, and go. like a massage, right? So you can see the needle on the screen. You see it going right into the tear there. So now it's in the tear. Now you're going to see the white, the plasma.
Being injected, basically.
Yeah, it's being injected, and now you're going to see it fill up the tear. You see how it
Oh,
filled
wow.
up?
Yeah.
So now it's all full, and so now that's going to help regenerate the fibers.
Oh, that's pretty cool.
That's it. That's
Oh,
it.
that was fun.
Pain, what was the pain? I mean, you didn't even twist or anything.
No, just do it.
Yeah.
It was like a tiny like needle, like on your back. I don't know how to explain it.
Yeah.
But when he like injects it, you can feel like a little expanding inside.
We saw it expand. It was just
Yeah.
like filled
Yeah.
up like crazy. I'll show you the video after. But no, pain level looks good. I mean, it's doable. I thought
Yeah,
it'd be
because
more
sometimes people
painful.
get scared
Yeah,
of doing it.
big
Like, oh,
needle.
it's going to be really painful and that
I
kind of
think
thing.
that the looser you are, the better.
Exactly, yeah. You have the right
Right?
mindset, yeah.
Yeah.
Some people just come in and they're all scared and shaky, and
Yeah.
then it's like, oh, it's going to be more
Yeah,
painful.
More nervous.
It hurts
Yeah.
more when you're like tighter.
Yeah.
Mhm.
Okay guys, that was it for the procedure. Everything went smoothly. As you can see, we guided the needle directly into the spot where her tear is and where her source of pain is. So unfortunately, it was never diagnosed, and she's had this for over 4 years. You heard her story. You've heard from my other videos too, how chronic pain can affect people's lives. It can really affect your quality of life and make it difficult to do daily function. So if you have someone who's suffering, or if you're suffering, you can share this video with someone, and hopefully you liked it. And please subscribe, and I'll see you guys in the next video.